Welcome to the Australian Prescriber Podcast. Australian Prescriber, independent, peer-reviewed and free.
I'm Danelli Pereira, your host for this episode, and it's a pleasure to be speaking to Professor Amanda Wheeler. Amanda writes about the importance of reducing medication errors when patients transition between health providers. Amanda, welcome to the program.
Good morning, how are you?
I'm good, thank you. Thanks for your time. So, Amanda, can you start by telling us why medication errors at transitions of care are such a big problem? What are some of the consequences of these discrepancies?
It's been estimated that around half of the medication errors that happen in hospital occur on admission or discharge. And about 30% of those errors have the potential to cause serious patient harm. Obviously, the type of patient harm is, if medicines are discontinued in error, or there's doubling up of medicines, or there's a failure to detect a drug-related problem, or perhaps medicines actually inappropriate for a person, then they can have serious adverse consequences for the person, and they can lead to drug interactions and adverse effects.
Yeah, absolutely. Your article identifies some groups of people who are at significant risk when these errors occur. Can you tell us about these groups?
I mean, obviously, people who have, complex medication regimes, who are on multiple medications, older people, those with mental health problems. And the reason why is often their care is shared between a psychiatrist and a general practitioner. Other people who have difficulty navigating the health system, such as people who are socially disadvantaged or have low health literacy. And we know that Aboriginal and Torres Strait Islander people have difficulties with medicines and maybe on multiple medicines and seeing multiple different prescribers. Same with migrant populations. So these people are groups that we need to really focus on in terms of ensuring that medication information and accurate medication lists, we're sharing them between providers as they see a number of different healthcare professionals.
Yeah, I think you highlight the important point there, accurate medication lists. It's no point in having one copy that's sent around to everybody if all those copies are not kept up to date. Amanda, you also highlighted that the patient is the one constant throughout these transitions between different healthcare providers. How can health professionals actively involve patients in reducing these discrepancies?
Patients are integral to the process. They need to provide their current medication list when they see a health professional, and that's every time it's a different health professional. So that list could be on paper, it could be a photo, it could be a smartphone app such as the Medicine Wise, or they could actually bring all their medicines themselves. It could be their dose administration aid. And then the specialist and the healthcare professional, the GP, need to actually engage the person and talk to them about it. They also need to check that people understand what medicines they're taking and how they're taking them, because there may be doubling up issues. So they need to be, the communication is both ways, from the health professional and the patient and their carers.
So I think you've made a really important point there in that what the patient may actually be taking may not match what was intended. So despite the number of consistent sources of information you might have, they're really meaningless without that verification with the patient, isn't it?
Absolutely. And if a health professional then goes and changes the medicine, they've also really got to make sure that information is also conveyed onto other health professionals, but also to the patient and their carer. So there isn't a doubling up or a continuing of a medicine that they've actually wanted to stop. So, and providing the information about why they've changed it. I think it's not just providing a medicines list, it's actually a reason for why changes have been made.
Yeah, absolutely. So what is medication reconciliation, and where can health professionals go to find out how best to do it?
Look, it's a process that's been designed to improve communication and promote teamwork. And it's been shown to significantly decrease medication errors. So really what it is, it involves obtaining, verifying and documenting a list of the patient's current medicines, comparing that list of medicines to any medication orders, and also the patient's condition to make sure that the therapy is actually appropriate, and then to resolve any discrepancies. I think traditionally people have thought of this as a pharmacist's role, and I think in hospital situations we have medicines reconciliation that's been put in place at the points of admission and more commonly now at the point of discharge. But that's not to say that in outpatient situations or in primary care that medicines reconciliation isn't just as important. So I think that that's at any health professional who is at any transition of care, it's their responsibility to actually have a conversation with the patient about what they are taking, check their list of medicines, and look for referral letters from the GP or back from a discharge summary so that they're gathering that information. So I think it's that everyone has to value the importance of this process. For it to make any difference. So it's not just something for pharmacists to do. I think pharmacists are seen as medicines experts, and so it does fall naturally into their role. But every member of the healthcare team, and in hospitals, I think medicines reconciliation process is often seen as it's not valued, and so it's often given to a junior member of the team. But it's very important, and we all need to respect and value the process. So most health professionals these days are actually being trained in medicines reconciliation, but for those people who haven't come across the process or even sort of thought about doing it themselves, I think there's a really nice article that was published in the Australian Prescriber in 2012 by Margaret Duguid. It's about a 10-minute read, and it provides a really good overview of the process and the goals of the process and the steps involved in the process.
Oh, fantastic. But on top of that, I think there's also a couple of good videos on the Australian Health and Safety Commission website. So if people are interested in finding out more about how to do this process, they can definitely go there. So, Amanda, what are some of the consequences of poor discharge planning?
I think poor discharge planning, obviously, it's often medicines are changed while someone is in hospital, and if that information isn't communicated into a discharge prescription and also onto the community pharmacist and back to the GP, then the patient can go home and continue to take what they've been taking previously, and possibly in addition to new medicines, and the GP may continue to prescribe therapy that was actually changed during the admission. So I think it's very important for information to be communicated to both patients when they're discharged about, so going through what's been changed and why, and then also to the GP, so they're able to prescribe the new medicine plan.
Yeah, absolutely. So communication seems to be the key message through all of this. But I guess what's quite topical at the moment is e-prescribing. Do you think this is helping or hindering medication errors at transitions of care?
Look, I think e-prescribing it's reduced some errors, and then it's also increased other types of errors. So whilst it might have reduced errors around legibility and possibly adverse reactions, it can also introduce new types of errors, such as if people are selecting inappropriate medicines when in drop-down lists. And there needs to still be warnings in these systems to ensure that medicines that shouldn't be used together aren't prescribed. So it just shifts the error load, I suppose, and it's still about everyone taking care and checking medicines lists.
So what are medicine reviews, and how do they contribute to addressing this problem?
Well, I think medicine reviews, specifically home medicines reviews, this is a funded service that is provided by pharmacists in the community when a GP has made a referral to sort of say, look, I think this, I think there were some issues. So they're very important. And I think they've been really shown to reduce medication errors, particularly for people who are on complex medication regimes, and also for those who are recently discharged from hospital. That is a time when medicines can be quite confusing, especially for patients if they've got medicines at home still, they've picked up a new prescription of medicines, they've got new supply, and for a pharmacist to sit down and actually go through with them one by one with their medicines, and actually in an environment that is comfortable for them. Often that's their home, and they can also check all the medicines they've actually got at home and take away medicines that they don't need anymore. So there's no opportunity for misadventure with medicines like doubling up with different brands and things like that.
Okay, and so I guess if you could, have a pie in the sky kind of wish, what specific changes would you like to see that would reduce medication errors at transitions of care?
I think if I never saw written in the notes again anywhere, the medication plan was continue medicines as prescribed. So it
Yeah,
provides absolutely no information to anyone. So if
yeah.
every time someone was thinking about writing a note like that, they actually thought about, no, this is the opportunity to write what the current medicines list is and anything they've changed and the reasons why they've changed it. I think if we were all doing that, then I think we would probably reduce the risk of medication discrepancies enormously.
So that's unfortunately all we've got time for this episode. Thanks for joining us today, Amanda.
Thanks very much. It's been great.
Amanda Wheeler's full article is available online at nps.org.au/Australian Prescriber. The views of the hosts and guests on the podcast are their own and may not represent Australian Prescriber or NPS Medicine Wise. I'm Danelli Pereira, and thanks for joining us on the Australian Prescriber podcast.